Yeah, I would say the common problem, which is very well known to all, and all my urology friends will really vouch for it, is the prostate becoming larger. So, if you see the biggest difference between a male and a female, of course, there are a lot of others as far as the urinary urogenital system is concerned, is the prostate, because the prostate is there only in males and that enlarges as you grow older to a certain extent. So, it is known as benign hypertrophy of prostate, very common, and has usually causes a lot of problems like getting up a lot in the night, which we can talk about the symptoms a bit later. Then of course there is something known as urinary retention, which can also happen because of bladder problems also. A lot of people have maybe a sluggish bladder. If there is of course a history of neurological problems, for example paraplegia, stroke, then a lot of people can have bladder problems as well. Then another thing is, of course, urinary stones. Stones are also very, very important and very common, not only in the older adults, but if you have a history of stones in your family, then you can also have it later, and that can cause a lot of issues. Then post-procedure problems, especially like urethral strictures, they are also sort of quite common in the older adults, because if you see the channel of area where urology operates is very, very small, so there can be a lot of issues as well. Then, of course, I would say it was one of the most commonly seen cancers in older adults. That is, of course, CA of prostate. It will not be alarmingly causing a lot of issues. Of course, it depends on the stage that they present with. Hematuria can be one of the ways it can present. So that is also another thing which is very important. By hematuria, I mean blood in urine. Uh, so these are the usual common ones. Another thing that is a lot of people have just this tendency of drinking too much water. So we have to understand with age, especially in males also, that as we grow older, the kidney does not work at the same potential it used to work earlier. So if you drink a lot of water, especially after 6 p.m., then it leads to pushes the kidney to work even more. So you might have to get up multiple times. Then another thing which is commonly thing is constipation and urinary problems are also pretty much related. So if you have constipation, then there is a huge chance that you will have urinary problems also. So you have to make sure that the constipation is also taken care. Commonly neglected. They are a bit sort of interconnected. And of course, one of the biggest things which is a problem of urinary problems in older adults is urinary incontinence, because using control on your own urine, soiling your own clothes, that can be sort of a big problem.